Hi everyone, my name is Dr. Nixon Omulimi. I'm a consultant physician and Director of Medical Services based at the St. Teresa Mission Hospital, KIIRUA in Meru County. Today, we join the rest of the world in marking the World Kidney Day, whose theme is Are Your Kidneys Okay? Detect early, protect kidney health. And today, that will be our focus as we continue to ask this question. Are your kidneys okay? Why do we worry about the kidneys? Because the kidneys play a vital role in our body. All of us, or majority of us actually, have two kidneys. A few may be born with one kidney, but these kidneys play a vital role in our day-to-day life. The most important role is to eliminate toxic substances from our body, which if they accumulate, then they tend to cause more problems to our bodies. Some of these toxic substances are what we call urea, creatinine, or uric acid, amongst many other substances. Because the food that we eat, when they are broken down, they release these substances, which have to be eliminated. And the only way to eliminate them is through the kidneys. The kidney serves many other roles in terms of trying to balance some of the minerals in the body and some of the chemicals in the body, and also try rid excess fluid out of our body. So that if your kidneys are not working properly, then you tend to retain more fluid in your body. And that is why the kidneys are very important. If we don't take care of your kidney, then you end up with what is known as chronic kidney disease or an acute kidney injury. So basically, kidney disease is divided into those two aspects: acute kidney injury or chronic kidney disease. Acute kidney injury usually occurs because of reversible causes. For example, if you've been having diarrhea, you've been vomiting for a long time, then more often than not, it means that your body is depleted of this fluid. And once the kidneys don't get enough fluid, enough blood supply, then they won't function optimally, and you get what is known as an acute kidney injury. However, in other instances, you can get progressive loss of function of the kidneys, and we usually use a cutoff of 3 months. So if your kidneys are not working optimally for more than 3 months, then that is the time we call it chronic kidney disease. Today, I wish to focus more about chronic kidney disease and talk to us about chronic kidney disease. As I've mentioned, chronic kidney disease is when your kidneys fail to function optimally for a sustained period of more than 3 months. And this is usually caused by several things. Several diseases actually put you at risk of developing chronic kidney disease. In our setting, and even globally, we realize that diabetes is the number one cause of chronic kidney disease. And this is not just diabetes type 1. Mainly we see it in type 2, but in a few cases we also see it in type 1. But overall, diabetes in general puts you at risk of developing chronic kidney disease. There are other things like obesity. That is basically when you have excess weight, then that also puts you at risk. Hypertension, although sometimes hypertension actually is a consequence of chronic kidney disease and not a cause. In a few cases, you can get hypertension leading to chronic kidney disease. Other causes, or basically risk factors, if you have a strong family history of chronic kidney disease, that predisposes you to developing chronic kidney disease because there might be what we call genetic component related to that makes you at risk. And then there are other diseases or what we call inflammation of the kidneys. So for a long time, if, for example, you've gotten infections involving the kidneys, then you end up with chronic damage to the kidneys, both the structure and even the function of the kidneys. And if that progresses over time, when it's not well managed, then it progresses to chronic kidney disease. So just to list a few, those are some of the causes that we find in our setting that lead to chronic kidney disease. Why do we care so much about chronic kidney disease? One, because it's a very common disease that we encounter in our population. If you look at the statistics globally, about 10% of the entire global population suffer from chronic kidney disease. 10% means 1 out of 10, and that is such a huge number. To narrow it down, in sub-Saharan Africa, where Kenya actually belongs, the prevalence is much higher than that 10%. Currently, it stands at around 15%. That means 14 or 15% of the population suffer from chronic kidney disease. The other thing that we care so much, other than it just being a common disease, is the complication that are associated with chronic kidney disease. With chronic kidney disease, it puts your heart at risk. And that is why we have to address it from that angle. Why do I say that it puts your heart at risk? Because one, as I've mentioned, chronic kidney disease can lead to hypertension. And with the hypertension, it can make your heart enlarge. It can lead to instances of stroke, and all that are really catastrophic. Besides that, with a chronic kidney disease, it can make your blood vessels very stiff. And that is how you end up with reduced blood flow, let's say to the heart, and you get instances of people developing heart attack just from chronic kidney disease. And that is why it is important for us to have this conversation about chronic kidney disease. In terms of the other thing I will wish to mention is about the staging. So there are 5 main stages of chronic kidney disease, and that is usually based on how well your kidneys are functioning. And there are blood tests that you do so that you are able to classify someone as either stage 1 all the way to stage 5. So stage 1 is basically the early stages all the way to stage 5, when we basically say you have kidney failure. And at that moment, now the treatment options are usually limited. We have to do what we call replacement therapy, which is either by dialysis or by doing kidney transplant. Having said that, having mentioned the burden of this disease and the implication, it's important maybe for you, the listener, who is asking, how do I tell that I may be having chronic kidney disease or I may be developing chronic kidney disease? In the early stages of chronic kidney disease, like stage 1, stage 2, unfortunately, you may not experience any symptom. And that is the danger with chronic kidney disease. It is another silent killer because in the early stages, there are basically no symptoms. You are living a normal life, and probably one day when you go to the hospital, a blood test is done, it's checked, and then you're told your kidneys are not working properly. That is the essence of detecting early, and that resonates with the theme of this year. The other important thing is that in the advanced stages, you may get very non-specific symptoms. So there are no classical, what I would say, classical symptoms, or if you experience a certain symptom, that I will say now you have developed chronic kidney disease. The symptoms are very non-specific. The reason why I'm saying they are non-specific is that they may be associated with many other conditions that one may be suffering from. And maybe just to mention a few, in advanced stages, you may get nausea, vomiting, fatigue, you get generalized body weakness. And from that, the listener, you can realize that they are very non-specific because they don't point to a specific thing. Or sometimes in advanced stages, you may get your leg swelling. They swell because now your kidneys are not able to eliminate the excess fluid that you take. And all the leg swelling can also be attributed to many other diseases, especially heart diseases. If you have a problem with the liver, if let's say there is a reduced production of protein in your body, and all those can still contribute to your leg swelling. So from that, you realize that the symptoms are very non-specific, and it's important for us to be able to detect early. And that is why my message today to all of you who are listening to me is one, if you are at risk of developing chronic kidney disease, then it is important that you have come to the hospital and have yourself checked. How do we do this? One, we can do a simple urine test, what we call a urinalysis. With the urinalysis, we are able to see if you are developing signs of kidney disease. There are a few parameters that we check in the urine, and like presence of blood, presence of protein in urine. It means that your kidneys are not working optimally, and that is why you are leaking the red blood cells. That is why you are leaking the protein in urine. And with that, then we can institute appropriate treatment that will be able to slow down the progression. The other simple test that we do is it's a blood test. So you have a blood sample taken, and then we check for the kidney function. And our main interest is usually the urea and the creatinine levels. These are substances that ideally are supposed to be eliminated by the kidneys. So when the kidneys are not working optimally, then you tend to retain high amounts of urea, you tend to retain high amounts of creatinine than what is recommended. And with that, then we can tell and even use that to classify which stage of chronic kidney disease you are in. And for every stage, then we are able to institute appropriate measures so that we slow down the progression. You may be wondering, what are these measures that we institute? First, as I said, the most important thing is, as much as possible, try to address the underlying cause. For example, if the chronic kidney disease is caused by obesity, which, as I've mentioned, is the commonest cause, then we ensure that your sugar control is optimal, that you're taking your medications that are optimal, and again, we are taking medications that are friendly to the kidneys, because there are those medications, let's say for hypertension or diabetes, when your kidneys disease is advanced, then it causes more harm than good. So that is one thing that we do. So if it's diabetes, we get it sorted out. If it's hypertension, we ensure that your BP is well controlled, and we also ensure that you're on the right medication that do not worsen your kidney function. Besides that, there are other medications that we can put you on that have been proven to show that it slows down the progression of the kidney disease, and also those other medications that reduce those toxic substances or waste products that ideally should have been eliminated by the kidneys. Then those medications tend to bind and eliminate those toxic substances through other channels. So that is what we can do in the early stages. And besides that, we also ensure that you don't take medications and you are counseled on the medications that may be more toxic or more harmful to the kidneys. And therefore, we begin a journey with you and ensuring that we slow down the progression of the kidney disease. In case it gets to an advanced stage where in stage 5, where we cannot do anything other than replacement therapy, then we institute dialysis. Dialysis or transplant is usually the last option. More often than not, we don't recommend, or we don't really wish that we get to that level where you have to undergo dialysis, because then that poses a great burden to you, maybe financially, economically, even socially, because that means that you have to be dialyzed a minimum of 2 times a week. Ideally, it's supposed to be 3 times a week. That means 2 or 3 times in a week, 3 days, you are not able to carry out your activities of daily living. And that puts a strain even on yourself economically. And therefore, we use dialysis as a last resort when we cannot do anything else. And that is why our rallying call is to ensure that we are able to detect kidney disease early, institute appropriate measures, and reduce the number of people who require dialysis or who require a kidney transplant. Because kidney transplants are not easily available in this country. Again, there are few centers that are able to provide that. Besides that, it may be very costly because there are a number of tests that you are supposed to do before you're able to have a transplant done. Some of those tests are very costly. But more often than not, sometimes the elephant in the room is getting someone who is more than willing to donate a kidney to you. Or they may be more than willing, but they are not a match. So you cannot receive their kidney. So those are some of the challenges that are posed to those patients who require transplant. And therefore, it is important that we prevent before it gets to that stage. Here at St. Teresa Mission Hospital, we are able to work with you, especially if you have the risk factors, and we are able to run some of those tests, like we are able to do a urinalysis, we are able to do the kidney function test, we are able to check the kidney sizes, and we are able to investigate further to try to find out the possible causes of the kidney disease. So we'll recommend that for all of us who are listening to me, kindly ensure that you have your kidneys checked today. Don't miss this opportunity. Don't postpone it, because you never know. As I've said, early stages and even late stages, the kidney disease, you may not experience any symptoms. So prevention is better than cure, because when it gets to end stage, there is very little that we can do. So we'll recommend that you come, have those tests done at a very affordable price, know your kidney health, protect your kidneys, and you're able to live longer, because there is nothing that compares to health. The greatest wealth that you can have is your health, and that health begins with your kidney health. In conclusion, I will recommend that we take good care of our kidneys. And how do we do this? Number one, regular screening, because the disease, more often than not, has no symptoms, especially for those who are at risk. Ensure that you have a urine test and blood sample taken. Then you are able to monitor or check your kidney function. So regular screening, especially for those who are at risk, diabetes, hypertensive, those who are obese, those with a family history, very important. Number two, be physically fit, exercise as much as possible, very important for your kidneys. Avoid high salt intake. Excessive salt is harmful to your kidneys. The other thing that you need to do is to keep hydrated. Ensure that you keep hydrated all the time. Avoid smoking. Smoking has been shown to actually worsen the progression of kidney disease. The other important thing that you need to do is to avoid over-the-counter painkillers, because most of them have been shown to be detrimental to the kidney function. And more so if you already have chronic kidney disease, especially in the early stages. So avoid all those. Please, if you are able to do that, spread this message, inform your loved ones to take care of their kidneys, because your kidney is your health and your health is your wealth. Thank you.